Yes, good morning, and thank you to the committee that organized this conference and to give me the opportunity to present today. So, Alzheimer's disease is the most common form of dementia in the elderly. There is no clear consensus on the preventive measures available to prevent its development. We also have different hypotheses that justify this specific Alzheimer's disease. I think the most possible one is the amyloid hypothesis. This hypothesis defends the theory of an accumulation of an amyloid peptides that are formed through specific precursor proteins. It's called amyloid precursor proteins and the formation of the amyloids. Then we also have another hypothesis, the cholinergic hypothesis, which establishes a correlation between cholinergic deficiency and the loss of patients' cognitive abilities. We have different medicines available in order to improve the patient's capacities, and they are cholinergic medicines or drugs. We also have other hypotheses that are trying to analyze the different phenomena that take place on these patients. And one of these phenomena is the free radical hypothesis. We see that our brains are particularly sensitive to specific oxygen processes, reacting oxygen species. And these are very related to aging and different degenerative processes that take place in aging. DNA found in the body cells, especially in neurons, can conduce to general death of the cells. In normal conditions, the organism has different chains of reactions that are taking place. You can see them here. They include antioxidant agents as well as enzymatic agents. In these conditions, we see that we have an imbalance, a loss of balance between all of these reactions, the oxygen reactions as well as the different reactions that take place in cell, and this provokes cell death. We see catalase, glutaminethone peroxidase, and different reactions that are taking place. And now we have the non-enzymatic antioxidant agents that include different vitamins. We have vitamin A, vitamin C, and vitamin E. We have also noted that AD patients have different factors in their brain. Neuroinflammatory factors generated by the neurons, astrocytes, and microglia. All of these theories have enabled us to develop different strategies in pharmacy, in the pharmaceutical industry. We have antioxidant drugs at our availability, and we also have free radical uptake drugs as well as neuronal anti-inflammatory drugs. One of the most crucial elements in Alzheimer's is aluminium. Aluminium provokes cell damage, and it can also generate free radicals, which provoke oxidative stress. There's been different studies that try to define the reactions that take place with aluminium. We see that aluminium has a biphasic action. It can inhibit the actions of different enzymes. It can also provoke reactive oxygen species, which provoke oxidation in the cells themselves. We see that aluminium can also interfere in the cholinergic system, which creates the acetylcholinesterase, which is a substance very related to the reactions that take place in Alzheimer's patients' reactions, their bodies. We see that there's also different protective factors that can prevent the development of the disease, delay the onset, slow its progression, and reduce its symptoms. We see also that beer is one of the most consumed beverages worldwide, and it could prevent Alzheimer's due to two different components. We have hops as well as silicon. This is one of the beverages that has the most silicon content. Over the past few years, we've seen more and more interests on the possible therapeutic effects of silicon. We see that silicon is now related to maintaining the structural integrity of nails, hair, and skin, the global collagen synthesis, mineralization, bone health. It is also able to reduce the accumulation of metals, and so on. We have also seen different studies on the reactions, the interaction between silicon and aluminium. We have silicic acid. We see that both substances promote the generation of aluminium. We see different soluble substances, such as the silicates, the silicon derivatives. We've also seen different studies with water, which contains silicon, and we saw that the consumption of this water enabled to reduce the total amount of aluminium. So we can see that these substances could be used in long-term therapies in order to reduce aluminum content in the body burden and would thus delay the onset of Alzheimer's disease. Taking into account these different theories, we have developed a hypothesis on the effects of the absorption in the gastrointestinal tract. So we decided to determine the effect of beer consumption on the bioavailability of aluminum. We decided to take two different studies. We started with an acute study of 3 days with the aim of establishing the type of beer, whether it would be alcoholic beer or non-alcoholic beer, and then we had another study on the type and dose of the most effective beer. That way, we could develop a chronic study. This study was made with male mice, and it enabled us to concentrate on the different results by urine, feces, and brain collection. We saw that beer intake enabled us to detect the aluminum absorption and thus analyze the different excretion kinetics. The most effective beer was the alcoholic beer. And this served us to work on our second study, which was the 3-month study. We had 3 different groups of animals. We had a negative control with deionized water, and then we had 3 different groups with aluminum. We had alcoholic beer in one group and silicic acid on the other group, with a higher dose than the dose we find in beer. After 3 months, the animals were sacrificed, and we were able to establish the quantity of metal, both in the brain as well as the blood. We decided to establish different parameters for lipids peroxidation, such as the TBARS index, and then we decided to analyze the enzyme activity, different inflammatory factors, as well as the gene expression. we had different conclusions. We were able to see that silicon enabled us to block the pro-inflammatory and pro-oxidant actions induced by aluminum. So the hypothesis was confirmed. We could use beer as an effective prophylactic measure to prevent the development of Alzheimer's disease. However, the alcohol content, although not very high, would limit this recommendation for an application to the entire population. We started a new trial in which the goal was to establish the effects of non-alcoholic beer and some of their ingredients regarding pro-oxidant effects and pro-inflammatory effects and neuronal toxicity. What we did was to evaluate the degree on cerebral oxidative stress. We quantified antioxidant enzymes. We determined the possible involvement of inflammatory mediators, and we evaluated the neurological progression of animals that had received the different treatments. This with the goal to see how it affected to the neurological damage that could have been provoked by the aluminum, and to see if the components of beer could revert this effect. Before the in vivo trials, we had some in vitro tests to determine beforehand if the compounds that were going to be administered to animals could be effective. We determined the antioxidant capacity of beer, silicone, and hops, and the acetylcholinesterase activity. These trials would afterwards enable us to evaluate the results and compare them to the previous results obtained. So as you can see, beer presented an antioxidant capacity very higher than hops and other substances. This is very important because if we remember correctly, aluminum had the other effect, the opposite effect. So this body burden due to the silicates could result in a new mechanism to revert toxicity of aluminum. In vivo trials were quite similar to the ones carried out before, but there was a new group of mice that were fed hops and intoxicated with aluminum. It's important that we also carried out behavioral tests. There was one with whole boards and one with forced swimming. The first one, the one with whole boards, allowed us to collect variables indicative of motor activity, exploration, and emotionality. This is how we adjusted grooming, defecation index, mobility, curiosity, and rearing. The forced swimming trial allowed us to evaluate the capacity for learning and memory of the animals depending on the time they spent swimming or not moving. The results are reflected in this slide. As you can see, aluminum affected all these different parameters: mobility, defecation. There was less curiosity and rearing. All these effects were reverted both by beer and its components. Even in the group with silicone, the effects on memory were better than that in the control group. Regarding the forced swimming test, the same results were obtained. Aluminum increased learning time of the animals due to its effect on acetylcholinesterase activity, and beer and silicone seem to neutralize this effect. As I said, the results were better even than in the control groups. This is basically due to the capacity of silicone to increase the acetylcholinesterase capacity. The ex vivo tests, were similar to those I have talked about before. The results were the following. First of all, we measured the concentrations of aluminum in plasma and in the brain. We could see that the concentration were increased in the group of aluminum intoxicated animals, and they were reverted when they had intake of beer and silicone, not in the case of hops, and this indicates that the action mechanism of hops is different to that of silicone. There are no hydroxyaluminum silicates. So, non-alcoholic beer and silicic acid reduce the accumulation of this metal in the brain, and this indicates that there could be a possible use as a long-term non-invasive therapy to reduce aluminum in patients, not only in patients with Alzheimer's, but in many people. Regarding oxidation, we see that aluminum, there is an oxidation pattern induced by this capacity to form free radicals, and silicone proves able to reduce this effect provoked by aluminum. In the case of hops, we can see that there was also a reduced lipid peroxidation, but in this case it is due to the polyphenols in hops. Regarding glutathione, we can see that there was an increase in the redox index, and how beer and its components can revert this effect. However, beer is the most effective in this sense, not its components. As we have seen also in the in vitro test, it's the beer that has the highest antioxidant capacity. Regarding anti-inflammation, aluminum also increases significantly TNF-alpha due especially to its interaction with the cholinergic system. Silicone can reduce these inflammatory factors, such as just as lupulus can. Lastly, we wanted to analyze the gene expression and activity of antioxidant enzymes. We can see the results here, and we can see that intake of non-alcoholic beer normalizes these enzyme activities, and thus we could say that non-alcoholic beer and its components could evidently improve antioxidant defense in the brain. The conclusion of this study is then that due to the capacity of its components to alleviate the neurodegenerative effects induced by aluminum intoxication, moderate consumption of non-alcoholic beer provides an effective prophylactic measure for preventing the onset and the development of Alzheimer's disease. Thank you for your attention.